always think about these all on 4, all on 6, all on X, whatever it ends up being, and thinking about how challenging this must be, especially from a patient's perspective, because it's the only perspective I really have. And I think about the aesthetics of this, and you sometimes see people with, I see people out in the world that I can tell they have dentures, or I can tell they have a dental prosthesis of some kind, an all on X case. So how can we make sure that with each patient that these all on X cases are customized to them?
Right. Sure. Yeah, that's kind of a two-part question in that sometimes it's not the clinician's fault or the laboratory's fault. It's the patient's fault. They want these perfectly straight teeth and they want them all to be a bleach shade. And in my opinion, that looks like a denture. So it just kind of depends on the patient. There's a way to approach things where if the dentist is doing the wax try-in, for example, on these all-on-4 cases, they can encourage the patient to kind of move some teeth a certain way. Nothing drastic, but just something that's nice and subtle that lends that natural appearance to them. And luckily, as opposed to with a denture, where you really only have a tooth that is all the same shade, with all-on-4s, we can subtly change the shade throughout the tooth so that the gingival area is a little bit different color than the incisal, for example. And then you got embrasure areas that you can put slightly shading in. Nothing that's offensive, but when you look at it, you wonder, okay, is that a real tooth or is that a prosthetic? You know what I mean? So that's kind of the magic of dental technicians, is we go in there and trying to figure out, well, how do we make this thing so that the patient likes it, but it doesn't look like it's a fake anterior bridge or whatever it is that we're doing. And I think we do a good job doing that, but you have to have a clinician that's interested in kind of educating the patient sometimes and letting them know, hey, look, you got 2 ways to go here. And then ultimately the patient makes the decision, and we do our very best to make them look like natural teeth irregardless. One last thing I'd add on that I almost forgot is photos. We're big on photos. That's how we can personalize it to the individual patient. We need to see their face. And so we need to have like a full face photo of them in a broad smile. We need to have a photo that's taken of up close of just maybe the wax try-in in an all-on-4 situation, so we can see how the wax try-in is laying out. And that's straight on. And then from right and left side, it's slightly an angle, so we can see it from that side of the wax try-in. And then the last photo would be like totally on the side, so we could see the overjet of the maxilla and the mandible, so we can kind of see how that looks in the patient's mouth. Photos, man, if there's one skill that the dentist can learn, it's easy nowadays because we have all this technology, is to send the laboratory really good quality photos. And then that helps us. We can see the patient. We can see how their nose might move to one side, or when they smile, how much gum is showing or how much is not showing. It's like they say, picture says 1,000 words, right?